Welcome back, guys. Now in this video let's discuss about jugular venous pressure changes. So in the name itself it's very clear, pressure changes are happening where? In the jugular veins, in the internal jugular veins the pressure changes are happening. Now please look at here, guys. This area is the right atrium. This is the right atrium. Right atrium is in contact with what? Its direct connection with the superior vena cava. So superior vena cava is bringing the deoxygenated blood to the right atrium. Of course, even inferior vena cava will also bring the deoxygenated blood to the right atrium, but we are not concerned about that. Right now, what I am discussing here is the superior vena cava is bringing the deoxygenated blood to the right atrium. Now, the superior vena cava, it is in direct contact with the right or left internal jugular vein or not. See, here is the internal jugular vein. Now this internal jugular vein, it is in connection with the right atrium or not? Yes, they are almost connected. So what I am trying to put into your mind is any pressure change here in right atria will create a pressure or will cause a pressure change in the internal jugular veins. Okay, any pressure change here in right atria will cause a pressure change in internal jugular veins. For example, during cardiac cycle, with the different phases of cardiac cycle, pressure will change in the heart, pressure will change in the right atrium. So such pressure changes are reflected in the internal jugular veins. Why? Because both of them are connected. Okay, now let's see what are these pressure changes. Now these pressure changes are actually noted in the form of waves. So what are these waves, sir? A, C, X, V and Y waves. Okay, this is the A wave, which is a positive wave. Okay, A wave, C wave, X wave, V wave and Y wave. Okay, A wave, C wave, X wave, V wave and Y wave. Okay, now why there is an A wave? See, we can clearly see in the jugular veins the pressure is increasing or not. See this one. Okay, see this, let me show. This is a A wave. Okay, this is a A wave. Now why pressure in the internal jugular vein is increasing? Why? Because A wave represents what? A wave represents atrial contraction. When the atria are contracting, pressure inside the atria increases or not? Pressure inside the atria increases, sir. Okay, so automatically pressure in the internal jugular vein also increases. Simple. So A wave is because of the atrial contraction. Try to understand like this. Okay, when the atria are contracting, the pressure inside the atria increases as well as the pressure inside the internal jugular vein also increases. Simple. Okay, now when the atria are relaxing, see, when the atria are relaxing, automatically pressure in the atria is becoming less. Atrial relaxation, pressure inside the atria is relaxed. Okay, automatically the pressure inside the internal jugular vein also getting decreased. Okay, so see, the pressure inside the internal jugular vein is coming down. Okay, coming down. Actually this is represented as X wave. Okay, this is X wave. So X wave is because of atrial relaxation. In most of the books this point is skipped. Okay, in most of the books this point is skipped, so I am also not making any point over here. So what I am saying is simple. They will ask you, A wave is because of, A wave is a positive wave, pressure is increasing. A wave is because of the atrial contraction. Atrial relaxation, okay, atrial relaxation will also decrease the pressure inside the, internal jugular vein. So pressure is coming down. Okay, pressure is coming down, which is represented as X wave. Okay, X wave. Now later what happens? Now later C wave. Okay, again there is a little increase in pressure. There is a little increase in pressure in the internal jugular veins. Now why this is happening? C wave is because of, remember something like C. C is because of the isovolumetric contraction of the ventricles. Okay, when the ventricles are contracting, see, when the ventricles are contracting, pressure inside the ventricle increases. Now when the ventricles are contracting, especially the right ventricle, when the right ventricle is contracting, it pushes the tricuspid valve. Okay, it pushes the tricuspid valve. Let me show you. See, this is the right side of the heart. I am only showing the right side of the heart. This is the right ventricle. When the right ventricle is contracting, the pressure inside the right ventricle increases. Now it will pushes the tricuspid valve into the right atria. So right atrial volume, what happens? Right atrial volume decreases. Right atrial volume decreases. Okay, so what happened to right atrial pressure when volume decreases? Pressure increases. When right atrial pressure increases, automatically internal jugular venous pressure also increases. So that's why there is a small change. Okay, now later what happens? Now ventricle is relaxed. Now what happens? Again the valve goes back to its normal place. Again right atrial pressure decreases, right atrial pressure decreases. When right atrial pressure decreases, internal jugular venous pressure also decreases. Okay, please concentrate. So C wave, it is because of the bulging of tricuspid valve into right atria during ventricular contraction. When ventricle contracts, tricuspid valve goes into the atria. So atrial volume decreases, atrial pressure increases, so internal jugular vein pressure increases. Later what happens? Ventricle relaxes, tricuspid valve will go back to its original position, ventricular pressure decreases, atrial pressure decreases, so internal jugular venous pressure decreases. Okay, so downward movement of the tricuspid valve, like it is represented as X dash, X dash. In most of the books, they will simply mention this X dash as simple X, X wave. Most of the books they will call it as X wave, A wave, C wave, and X wave. Okay, they specifically mention you X and X dash, you know it. X is because of atrial relaxation, X dash or X prime is because of the ventricular relaxation. Ventricle relaxes, tricuspid valve go back to its original position, atrial pressure decreases, internal jugular venous pressure decreases. But in most of the books they won't give like X and X dash. In most of the books what they will give is simply A wave, C wave and X wave, X wave. Okay, A wave, C wave and X wave. So this X wave, this is a negative wave, the pressure inside the internal jugular vein is going down. Okay, the pressure inside the internal jugular vein is going down. Okay, because ventricle is relaxed, atria are also relaxed. Now internal jugular venous pressure also goes down. Later what happens, sir? Now V wave, see again there is a positive wave. Okay, again there is a positive wave. Now why this positive wave? See, remember V like venous filling. Okay, remember V for venous filling. Okay, so atria is filling with the venous blood. Okay, atria is receiving the venous blood. Now atria will receive the venous blood, right? Okay, so atria is receiving the venous blood. When venous blood is coming into the atria, atrial pressure increases. When the right atrial pressure increases, automatically internal jugular venous pressure also increases. So venous filling, V for passive atrial filling, when the atria are filling with the blood. Okay, when the atria are filling with the blood, atrial pressure increases, internal jugular venous pressure also increases. Simple. Now let's talk about the Y wave. Now Y wave, see it's a negative wave. Okay, X wave and Y wave are the negative waves. A wave, C wave and V wave, ACV. Okay, ACV are the positive waves, X wave and Y wave are the negative waves. Remember Y for emptying, atrial emptying. Okay, atrial emptying, not atrial contraction, atrial emptying. Okay, simply opening of the atrioventricular valves, opening of the mitral valve, opening of the tricuspid valve will move the 70% of blood from the atria into the ventricles, right? So atrial emptying, when the atria are emptying into the ventricles, atrial pressure decreases. Automatically internal jugular venous pressure also decreases. So Y wave is because of atrial emptying with opening of the tricuspid valve, So these are the jugular venous pressure changes. With the changes in the pressures in the atria, jugular venous pressures also changes. Okay, so this is something absolutely normal. A wave, C wave and V wave are the positive waves, X wave and Y wave are the negative waves. A wave is due to atrial contraction, C wave is due to isovolumetric contraction of the ventricles, X wave is due to isovolumetric relaxation of ventricles, and V wave is because of the venous filling of the atria, and Y wave is because of the atrial emptying. Simple. Now after this, let's talk about some abnormalities in the jugular venous waveforms. Okay, JVP, jugular venous pressures are going to be sometimes abnormal. For example, now in this graph you can clearly see there is a large A wave. So this is something normal. Okay, this is something normal, A wave, C wave. But are you able to appreciate here? It's like a very steep, just like a mountain. Okay, so this is a large A wave. See, A wave is because of atrial contraction. If there is a large A wave, there is some problem with the atrial contraction or not. See, what is that problem? See, large A waves are seen in tricuspid stenosis or pulmonic stenosis. Remember, let's try to understand something like this. See, this is, I am showing the right side of the heart simply. Here is the right atria, this is the right ventricle. Now, what is tricuspid stenosis? The tricuspid valve, okay, here is the tricuspid valve, right? Now, tricuspid valve is stenos, okay, tricuspid stenosis. Whenever there is tricuspid stenosis, in order to move the blood into the right ventricle, right atria have to generate more pressure or not? It have to generate more pressure. When it is generating more pressure, the right atrial pressure increases, automatically which pressure increases? Automatically internal jugular venous pressure also increases. So there is large A wave. Okay, large A waves are seen in tricuspid stenosis. Same is true with the pulmonic stenosis also. Okay, sir, how sir? For example, let me draw it here for you. From the right ventricle, which blood vessel is going out? From the right ventricle, pulmonary trunk is going out. Am I right or not? So what is the valve which is present in this area? The valve which is present is the pulmonary valve. For example, here pulmonary valve is stenosed. When the pulmonary valve is stenosed, right ventricular pressure increases or not? Right ventricular pressure increases. Okay, blood is not moving forward. The blood is not moving forward. So now right ventricular pressure increases. When right ventricular pressure increases, automatically we know right atrial pressure increases. When right atrial pressure increases, automatically internal jugular venous pressure increases. Why? Because there is backflow of pressures. Okay, so in tricuspid stenosis and pulmonic stenosis, there are large A waves. See, no one is going to ask you the graph. No one is going to give you the graphs and ask you. Simply they will give you in your exam, large A waves are seen in which condition? Large A waves are seen in tricuspid as well as pulmonic stenosis. And cannon A waves. What are these cannon A waves? Okay, cannon A waves like this. Okay, they are just like a finger-like projections. Okay, they are not just like a hill. They are like finger-like projection, acute something like this. So these are again cannon A waves. A waves are because of the atrial contraction. Here also there is some problem with the atrial contraction. What is that? Normally when the atria are contracting, what should be the status of atrioventricular valves? Atrioventricular valves should be open. They should be open. Then only atria will contract. Atrial contraction, during atrial contraction, normally the atrioventricular valves they have to be open. Then only blood will move from atria into the ventricles, right? Now my question to you. For example, when the atria and ventricles, they are not coordinating. Okay, when the atria and ventricles, whenever they are not coordinating, atria are contracting, ventricles are contracting at the same time. And the walls in between them, they are also closed. So atria are contracting with the closed walls. Atria are contracting with the closed atrioventricular valves. Now tell me, do you think the blood is going to move from the atria into ventricles? No, blood cannot move from atria into the ventricles. Why? Because the walls between atria and ventricles are closed. Atria is contracting, ventricle is contracting at the same time. Why? Because atrioventricular dissociation, AV dissociation is there. There is no proper contraction. There is no proper sync. First atria should have to contract, then only ventricle should have to contract. But right now, atria, ventricle, they are contracting at the same time, which can be seen in the conditions like complete heart block. We have discussed in complete heart block or the third degree heart block, there is AV dissociation. Atria are contracting on their own, ventricles are contracting on their own. Okay, atria is controlled by the SA node, ventricles are controlled by the bundle office. So there is a possibility that they can contract at the same time. So what happens? When atria are contracting against the closed walls, the right atrial pressure increases so much. When the right atrial pressure increases so much, automatically internal jugular venous pressure also increases. So that's why you are having a cannon A waves. Cannon A waves are seen. So important point I want you to know is, see, right atrium is contracting while the tricuspid valve is closed during right ventricular systole. Both are contracting at a time. So commonly seen with what? Atrioventricular dissociation or complete heart block. Okay, third degree heart block, you can have this kind of A wave abnormalities. Now after this, see here, C wave is there, V wave is there, X wave is there. Okay, there is no A wave. Okay, there is small C wave, X wave, V wave and Y wave. There is no A wave. So what is happening with the A wave? There is absence of A wave. Again, A wave is because of the atrial contraction. If there is no A wave, means atrial contraction is not there. Atrial contraction is not there. In which conditions you will have no atrial contractions? Like atrial fibrillation. In atrial fibrillation, atria are not contracting. Atria are just simply they are quivering like this. Okay, they are just quivering. There is no proper atrial contraction. Atria, because of the so many impulses coming, they are not contracting. They are just shivering like this. Okay, quiver. We should say quiver. They are just quivering like this. So in atrial fibrillation, okay, there is no atrial contraction, or there is, I can say, atrial asystole is there. So there is no A wave. There is no A wave in the jugular venous pressures. Now after this, in the conditions like constrictive pericarditis. Okay, in the conditions like constrictive pericarditis, what happens? There is prominent X descent. Okay, prominent X descent. Please concentrate. See, this is the X wave, right? This is the X wave. Okay, it's very, very prominent. This is something normal. Okay, A wave, C wave and X wave is something like this. Now please look at here, it's very steep. There is a prominent X descent. Now why it will happen, sir? Prominent X descent. See, prominent X descent is seen in conditions like constrictive pericarditis. Whenever there is constrictive pericarditis, there is a prominent X descent. Constrictive pericarditis means the pericardium of the heart. The entire pericardium of the heart, it got calcified. Okay, the pericardium of the heart, it's very much calcified. So in constrictive pericarditis, you only know this one point, that will be more than enough for you. A prominent X descent is seen in constrictive pericarditis. Okay, and see, whenever you see such a graph like this, see here you are seeing the blunted X descent. See, here is a prominent, very prominent X descent, but here there is blunted X descent. There is no X descent actually. Okay, there is no X descent. So blunted X descent, okay, is seen in tricuspid regurgitation. This is very easy. This is the exact graph came in the recent exam. The recent exam which have happened like 10 days back, this question has been asked. Okay, in the recent FMGE exam, this question has been asked. See, I used to remember something like this. It's like, it's just, whenever I see such a graph, it just looks to me like a howling wolf or a growling wolf. Okay, for example, see something like this. You can have an eye here. You can just keep teeth. Like, just like looking like a wolf, right? So whenever you see such a pattern, okay, that is seen in tricuspid regurgitation. Okay, if you see such a graph, it is tricuspid regurgitation. Why? Because this graph is going to come again and again. You can see here also. Okay, again same graph. Okay, again same graph, just like a growling wolf. Okay, so here what you are seeing is a tall V wave. Whenever they use the word like a tall V wave, okay, whenever they use the wave tall V wave or blunted X descent, same answer, blunted X descent, that's a tricuspid regurgitation, or tall V wave, again same, it is going to be seen in severe tricuspid regurgitation. Okay, now after this, one more thing, where you will be having equal A2 V waves, means equal size. Normally A wave and V wave, they are not of like equal size. For example, let me show you. This is something normal. A wave is taller when compared to the V wave height. A wave is taller much more when compared to the V wave height. So in which conditions you will have A wave equal to V wave? In the conditions like atrial septal defect, simply remember atrial septal defect and constrictive pericarditis. Whenever you use the word constrictive pericarditis, what else you will see? There is prominent X descent. Okay, don't forget, the prominent X descent is seen in constrictive pericarditis. As well as in constrictive pericarditis, you can have A wave which is equal to V wave, A wave equal to V wave. Now after this, again see prominent Y descent. Are you able to see this like wolf appearance? Whenever you see such a thing, again tricuspid regurgitation, simply follow tricuspid regurgitation, that's it. Okay, so prominent Y descent, same answer. Prominent Y descent, same answer. Tall V wave, same, tricuspid regurgitation. And blunted X descent. So you will be having blunted X descent. Remember, blunted X descent. See, the X wave is not coming down. Blunted X descent as well as prominent Y descent. There is a prominent Y descent. Okay, there is a prominent Y descent, but there is no X descent. No X descent, but prominent Y descent. Again, tricuspid regurgitation. Okay, so no one is going to ask you like why this is happening. In the exam, what they will ask you is prominent Y descent is seen or blunted X descent is seen. In which condition? Tricuspid regurgitation. If at all they will give you a graph, just by looking at its appearance you can say, okay, this is tricuspid regurgitation. That's it. Okay, and here what you are seeing, this is a blunted Y descent. Blunted Y descent. Normally Y have to go something like this. Okay, Y have to go something like this, but here the slope is decreased. So blunted Y descent is seen in tricuspid stenosis. Tricuspid stenosis. Okay, the tricuspid valve is closed. Normally Y is because of what? Just tell me. Just think and tell me. Sir, Y descent is because of atrial emptying. Okay, I am not giving explanations because you just think. Okay, all the explanations I have given. Why there is A wave, why there is C wave, why there is X wave, why there is Y wave. Okay, I have given. Think for example, sir, Y wave is because of what? Atrial emptying. Atria have to empty blood into the ventricles. For example, if that is not happening, means what will happen? Pressure decreases? No, pressure is not decreasing. See, there is a blunted Y descent. For example, now let me show you here. See, what is the problem? Tricuspid stenosis. Tricuspid valve is stenosed. Okay, tricuspid valve is stenosed. Not severe, okay, not severe tricuspid stenosis, but tricuspid stenosis is there. Okay, not severe. Whenever there is a severe tricuspid stenosis, you will have large A waves. Yes, there is large A waves. True. Along with the large A waves, see, whenever along with the large A waves, what else you can expect? What else you can expect in tricuspid stenosis? One thing is large A waves. Okay. At the same time, whenever there is a tricuspid stenosis, the blood is not coming down into the ventricles, am I right or not? The blood is not coming, sir. Means atria are not properly emptying into the ventricles. Atrial emptying is represented as Y waves. Okay, atrial emptying is represented as Y wave. Now please concentrate, guys. This is like, which is normal. Okay, let me show you with the different color. See, this is the normal Y wave. Normal Y wave should look something like this. But when normal atrial emptying, if it is not happening, means there is blunted Y wave. Okay, blunted Y wave. So pressure is not properly decreasing in the atria. So pressure is not getting properly decreased in the internal jugular veins. So internal jugular venous pressure is not properly decreasing. So that's why, like, there is a blunted Y wave. Okay, it's not steep, it's like a blunt. Okay, seen in tricuspid stenosis. And same right atrial myxoma also. Whenever there is a right atrial myxoma, whenever there is a tumor over here, the tumor, what it will do? The tumor is going to come and close the tricuspid valve. The tumor will close the tricuspid valve. So atrial emptying into the ventricles does not happen. When atrial emptying into the ventricle, if it is not happening, means what happens? Y wave is going to happen properly. Is there is a normal Y wave? No, blunted Y wave. Atrial emptying is not good, so Y wave is blunted down. Okay, so with this I have discussed all the important points which you need to know for your exam. So normal jugular venous pressure changes, A wave, C wave, X wave, E wave, like Y wave, and abnormalities. Okay, you think logically to yourself, like why there is tall A waves, why there is canon A waves, why there is absent A waves, why there is prominent X descent, blunted X descent, why there is prominent Y descent, blunted Y descent. That's it. If you know this, that will be more than enough for your exam. Hope the video is helpful. Thank you.